This conference will now be recorded.
Hello, everyone. My name is Emily Roman, and I am the Transition Support Team Manager at the Alamo Area Council of Governments in San Antonio. Anna Glaser is with me, and she is one of the behavioral specialists on our team. Anna has 16 years of experience in working with people with intellectual and developmental disabilities, and she is the CEO of the ABA Center for Excellence in San Antonio. Anna is going to speak to you today about the unique practices that staff can implement in seeking to meet the needs of people who struggle with challenges associated with autism spectrum disorder. Anna, thank you for being here today. If you could please go ahead with your presentation, we'd appreciate it.
Thank you, Emily. Yes, so today I'll be talking about autism, some of the challenges presented, and how to work with people that have autism. So before I begin my presentation, I would like to point out that in the mental health community, we always use person first language, so we always refer to people with autism. But a lot of individuals with autism prefer to be referred to as autistic. That's just a preference, and that's something that we'll talk about, later on in the PowerPoint presentation. But I wanted to clarify that throughout the presentation, I will be using the term people with autism. So what is autism spectrum disorder? Autism is a disorder that affects the areas of socialization, communication, and repetitive patterns of behavior. A lot of people with autism benefit from ABA therapy, and in order to receive services from an ABA therapist, in order for a private insurance company to cover it, they require a person to have a comprehensive evaluation of autism and a doctor's prescription for ABA. And so once those things are in place, then they will cover the services for the most part. When we're talking about deficits in social communication and interaction, you see it in, for example, eye contact. Sometimes people with autism struggle making eye contact with people. Sometimes just kind of reciprocating interactions, like conversational skills. In the earlier ages, being able to imitate your peers and follow along with them and initiate play interactions or engage in different types of play, like parent or cooperative play, or using the way that they're intended to be used. Sometimes children with autism might line up their toys, instead of pretend with them or do something, like with cars, they might not do races, they might just line the toys up. So you see those kinds of things, and that's among children with autism. And that's one example of a repetitive pattern of behavior. Sometimes you see people with autism engage in self-stimulatory behavior, so maybe rocking back and forth or flapping their hands. Those are things that you would commonly see among people with autism. I do not diagnose autism. These are just things that I've observed in my practice. But a comprehensive evaluation of autism takes into account so many different developmental areas, and in assessing people with autism. So in the world of ABA, we have some ABA curricula that specialize in working with children with autism. I think some of the two that I've seen used most often are the VB-MAP And the ABLES, the VB map is the verbal behavior milestones assessment and placement protocol. And the ABLES is assessment. Oh, I can't remember the exact acronym for ABLES, but basically both of these assessments, they basically take all the developmental milestones that a child is supposed to meet at certain ages, and they break them down. So whenever parents take their children to the pediatrician, they're usually provided with a checklist. Like, by this age, you should be speaking. By this age, you should be walking. You should be, pointing to things, making eye contact. There's all these milestones that pediatricians keep up with. Well, the VB map is an assessment that breaks milestones down, and so that behavior analysts can teach kids a lot of these skills that are developmentally appropriate. The ABLES is the assessment of basic language and learning skills, and it's a little more extensive. And so they include areas as far as academics, social skills, play, independence, communication skills are really big in these curricula. So a lot of these ABA therapy programs do use these curricula pretty often. And so I'm going to go through kind of what does ABA look like in practice, and go over some best practices and how to implement certain goals and interventions. So one of the things that a lot of ABA therapists talk about is this idea of pairing. You're supposed to pair on the first day that you meet one of your clients. And basically what that means is that, I guess in layman's terms, what you're really trying to do is establish rapport. But from a more technical standpoint, what you're doing is you are pairing yourself as a preferred stimulus. So when you walk into somebody's home, you are considered a neutral stimulus. Nobody knows who you are. You don't have any sort of, you don't evoke any sort of feelings in anyone. You're just neutral. And so what you want to establish is for your client to like you and to want to play with you and to want to approach you. You don't want to be in a position where your client doesn't really want to be around you. So one of the first things that behavior analysts do is they pair themselves with good things. So they might come into a home and bring toys or candies or video games or something that they think that their clients would prefer. So that's usually how a lot of ABA therapy relationships start. This is something that I actually, pairing is something that I teach a lot of caregivers to do. I think, and when I'm talking about caregivers, I'm talking about parents or staff, teachers, anybody really that provides care that supports people with autism. So whenever I'm working with caregivers, a lot of times you see them asking a lot of questions or giving a lot of instructions. And so I often do teach them how to pair. And so what I teach them is to let the child take the lead in terms of, if they want to play with a specific toy, you play with that toy as well. You don't, and you don't ask them, you don't have any expectations of them. So in a pairing session, you would bring with you some preferred items, and you would freely give them over to the individual. So if you had M&Ms, you would hand over the M&Ms. If you had a toy that spins, you would give the toy that spins. You wouldn't expect your client to do anything at all. And this can be very difficult and counterintuitive because you're I discourage people from asking questions like, hey, how are you doing? What's your name? How old are you? Those types of questions, or questions in general, are discouraged, because when you're trying to get to know someone and trying to help them feel safe and comfortable, you don't want to expect them to respond to questions. So that's why it's better to, show up to the client's home. Well, I provide home-based and community-based services, and just play. You might show them a car and say, look, I found a car, it goes around and around, or there's an airplane, or I'm blowing bubbles, or look at me, I've got this new doll that you might like, as opposed to saying, okay, blow the bubbles, play with the doll, grab the airplane. Like, you don't really want to give instructions, because that's not the goal. You don't want to be seen as somebody that has expectations, because then you might end up in a situation where your client doesn't want to answer your questions and doesn't want to do what you ask them to do. So really establishing that rapport early on is really important to an ABA therapy session. And I think it's really important to teach it to caregivers as well, because I think caregivers are tasked with teaching so many things to their loved ones, and it is really helpful for them to how to play and how to build rapport, because that's going to help them to be able to have what we call instructional control. So instructional control means that when you ask your client to do something, they'll likely do it because they've kind of associated you as a fun person that brings fun things. And so it really makes learning a lot more fun when you like the person that's teaching you. So another thing that behavior analysts use a lot is discrete trials. We teach through discrete trials, and I've pretty much broken down what exactly a discrete trial is. A discrete trial is basically an instruction or an expectation, and then a prompt, and then of course the client's expected behavior, and then you give reinforcement. That is what a discrete trial looks like. So just to give you an example, I might say, come sit down with me. That's the instruction. And of course, either the child will come sit down with me, or they won't. If they don't, I might use a prompt. I might gesture to a chair and say, come sit down with me, and gesture. And then the person would sit down next to me. And then after they sit down, reinforcement is basically a way to encourage the client to engage in this behavior more and more. So if I want the child to sit down every time I say, come sit down next to me, then I would provide reinforcement. I might give them a high five, or I might say, oh, great job listening. Those are examples of reinforcement in the form of praise. I might give them a sticker, or or a toy, something that they really like to play with. So that is essentially what a discrete trial is. So whenever we're teaching our clients, that's always what we're doing, is discrete trials. There's a lot of people think of discrete trial therapy as very rote, and you're sitting at a table and working with flashcards, and that's not always the case. Like, you can use discrete trials in a naturalistic kind of way. One thing that I've noticed a lot when I'm watching caregivers give instructions is a lot. They might end up with compliance issues because the instruction is too elaborate or too difficult. So sometimes, just to kind of give an example, somebody might say, come sit down, and then, no behavior. Okay, well, sit over here. Okay, can you come sit? Okay, how about you come over here, you walk this way, you sit here. And so a lot of times I'll notice where people, they don't, a lot of kids with autism, it's best to kind of give them some time to process what you're saying. So whenever I'm teaching discrete trials, I often encourage caregivers to just kind of slow down, like give an instruction and then just wait, see what happens, then prompt. Because a lot of times your loved one just needs a little extra time to figure out what it is you're trying to get them to do. Prompt dependency is something we'll talk about more, throughout this presentation, but people with disease in general, they will wait for a lot of people's ability for a prompt instead of initiating a task. So you might see, for example, a child with autism, a lot of times you might see where they want something, like they want to get a cookie out of the cookie jar, and they don't know how to make that request, or they don't remember that they can make that request, or they need a prompt to make the request. And so you might see behavioral issues. You might see a tantrum or some other behavioral issue because the person wants something. And so a lot of times I've seen where kids with autism might wait around for you to say, what do you want? And that's their prompt to say, oh, I want a cookie. So that's something that's really common. Just this idea of prompt dependency, of waiting for a prompt before initiating an interaction. So the next point actually talks about man training. So teaching requests, to me, is extremely important. That is probably a lot of the ABA therapy programs you're going to see are going to focus heavily on, we call it manned training. So manding means requesting. If you look at behaviors as a form of communication, manding makes sense, or teaching requests makes sense. So whenever I get a new client, I always do a functional behavior assessment. And so that's basically where you try to find out what is this, you get a referral and there's a behavior of concern, a behavior that needs to be decreased. And it's usually something disruptive. But when you look at that behavior, you always want to think to yourself, what is this person trying to communicate to me? What do they get out of this behavior? What is the function? That's basically the premise behind a functional behavior assessment. And so oftentimes it's just a matter of not knowing a better way to communicate this want or this need that you have. And so that's where manned training really becomes crucial to a lot of people with autism. A lot of children with autism, they don't learn how to speak at the same age as the rest of their peers, or they might use sign language. They might need to learn how to use sign language, or they might need to learn how to communicate with pictures. They might not be able to repeat words, or they might be able to repeat words, but then not know how to use those words in a functional manner. And so when I'm working on manned training, one of the first things that I look at is, what does my client already know how to do? So if I have a kiddo that doesn't know how to repeat any sounds or can't repeat words, I probably will not require them to use words as a form of communication, because that can be very frustrating, where you might want to play outside, you might want someone to open the door, but you don't have the ability to say open the door. And so if that is the expectation, you're going to get really frustrated. So you want to make sure that when you're teaching requests, you're teaching them using skills that the client already has. Some clients, a lot of kids with autism are visual learners. They do really, really well with visuals. And so picture communication systems are usually pretty effective in teaching people how to make a request. But you have to make sure that your the individual that you're working with does have the ability to identify pictures and to match. So those are some things I look at. Another thing I look at is motor skills. If you want your child to learn sign language, it helps if they're at least able to imitate signs. So if you've got a child that really has a hard time with, you know, skills and they can't copy this with fine motor skill, copy the same signs as the ones that you're modeling, then sign language might be very difficult for that individual. Right away. So you always want to look out the way so that you can, it's going to be the easiest way to start communicating and give your client to get their wants and needs met as quickly as possible, because you want to replace those behaviors. You want whatever it is you're teaching, you want it to be just as easy, if not easier, than the behaviors that the person is currently using. So that's one thing that I usually assess first. So now that I've established, okay, this is how we're going to learn to communicate, there's a method to teach a person how to make a request. So usually when I start manned training or teaching requests, I always get a bunch of things that I know the child really loves. And I also want to point out that manned training is something that I use with children, teenagers, adults. Really and truly, if you think of behaviors as a form of communication, it's pretty universal. Most of the people that I work with, all ages, I'm teaching them how to request whatever it is that they that they are communicating through their behaviors. But it starts, but you start small and you kind of build it up. So usually I'll find out what are my clients' favorite things, favorite snacks, favorite games, favorite shows. Just I usually try to keep a list. A lot of times I'll do this through observation. I might see what kinds of things my clients gravitate towards, or I might ask the caregivers, what do they play with all the time? What do they really like? And so in the beginning stages of teaching requests, I would actually show them the item. So for example, if I know that my client really likes the phone, then I'm going to put it, hold it out so that they can see it. And I'm going to wait. So when you hold out the item, the first thing that you're going to want to do is wait for motivation. So if I show a phone to my client and they're not reaching or giving me any sort of indication of knowing that they really want that, then I would not require them to request it because they just don't want it. Sometimes, so I might move on to the next item. I might say, well, let me see if they like this pen. I'm just getting things in the environment that I have around me, but I'll say, well, I'll hold out the pen. Well, they didn't show interest in that either. So then I might go to something else. So maybe they want this notepad. So I'll start just kind of trying to see what things that my client wants. Once they reach or they try to grab or they show any sort of indication that like, oh yeah, I really want that, then that's when I prompt. When you're teaching a manned for the very first time, when it's brand new, I know that the presentation says use a time delay prompt, but that's actually later on. In the beginning stages, you would use an errorless prompt. That means it's a prompt where it's so fast and that the person doesn't even have a chance to make a mistake. So, for example, if I hold out my phone and my client, goes to grab it, I prompt them phone and see if they say phone. And this is where it helps to have other, you really do want the form of communication to be easy because if they're already repeating words, then when you say phone, they'll say phone, and then you'll hand over the phone. But if they're not really repeating words, it might help to have a picture available, or something else to let them know that this is the expectation. You have to say phone. So in the beginning stages, it's very fast. I hold out the item, they reach for it, and I quickly tell them, oh, phone. And then they say phone, and I hand it to them right away. I don't wait. It's very important that you give over the item immediately. You don't want to wait, because then that's when people start getting frustrated, and then they don't even know what to do at that point. So you always want to prompt as quickly as possible, and then you reinforce as quickly as possible. The reason that you wait for motivation is a lot of my clients with autism have the tendency to become very rote, and they just start, a lot of times I've seen a lot of my clients, they'll start guessing whatever it is the answer is. They might not even be listening to what you're asking them to do. They might not even know exactly what the expectation is, but they're guessing. And so a lot of times I've seen kids where they make requests just because that's part of the routine. It's not because they really want the item. They're just, it's what I do at this moment, you know, it's what I do at the therapy table, or it's what I do when we're playing, but they might not actually want the item. And you're trying to teach them that when they want something, they can have it by requesting. And so that's why don't assume that just because somebody likes something that they're going to want it at that very moment. You always want to wait for motivation. Later on, when you start noticing that your client or your loved one is actually starting to get the hang of it, like, oh, I request and I receive, I request and I receive, then you go into using a time delay prompt. So that's where you wait. So I might hold out the phone and just wait. My client might reach for it a few times, and I might just wait to see if they get the hang of, oh yeah, I'm supposed to make a request. And so, because you do want to increase independence at an early age, it really does become detrimental to not be able to initiate something without somebody telling you to. And so that's where time delay prompts are very valuable. But they can also be frustrating. If your child is still learning and you're already waiting them out, but they haven't quite learned the request, they might get really frustrated. So you're always kind of gauging it. Like you're always having to decide, am I going to prompt right away, or am I going to wait a little bit? Where are we in terms of our ability to make this request? Another thing you'll see in ABA therapy is this idea of repeated trials. So oftentimes as a behavior analyst, I get referrals from families that say that they were their child was recommended to have an intensive ABA therapy program, 20 to 40 hours a week of ABA therapy. And the reason that that intensive intervention is emphasized so much is because you get to practice the same skill over and over and over and over. Practice makes perfect. And so you need extra time in order to practice things. So if I'm teaching somebody to respond to the question, what is your name, for example, I might say, what is your name? And the person doesn't know how to respond, so I prompt them, oh, your name is, Jacob. So the person will say, oh, okay, my name is Jacob. Okay, then you try it again. Okay, so what is your name? Oh, my name is Jacob. Okay, perfect. Later on in the session, I might say, hey, what is your name? And they might not remember from 5 minutes ago, so you might have to prompt them again. It's Jacob, remember? And this is where visual prompts are really, really helpful. Kids with autism, they do tend to do very, very well with visual prompts. So I might write out their name if they can read, or I might put a picture. And And so they'll say, oh, so a lot of times I might just point to the picture and they'll say, oh yeah, Jacob. It's always better to use a visual prompt than a verbal prompt whenever you can, because a lot of kids with autism, they have really good memories. If you put a visual in front of them, they can pick it up pretty quickly and then remember what the expectation is. And so a lot of times you can fade those prompts in an effort for them to be more independent with that particular skill. With verbal prompts, it's really hard to fade, because how do you fade somebody's voice and presence? And so that's where it's always good to find visuals whenever you're trying to prompt somebody to do something. So one thing that I do want to point out, though, with repeated trials that's really important is there's many different schools of thoughts on it, schools of thought on this. There are a lot of ABA therapy practices that'll say, yes, we need you to be in receiving ABA therapy 20 plus hours a week, because you need that consistency. You need practice, practice, practice. And although I do agree with this, I think it's very, very important for the caregivers to be involved in those practice trials, because a lot of my clients with autism, they have a very difficult time generalizing. So they might learn the answer to a question in front of one person, but then they might not know that same answer to that same question with another, or they might in one environment, like they learned it in the kitchen, but then you take them to a classroom and that same skill, the skill didn't change, the environment changed. They have to be taught in that environment. And so that's where caregivers are really helpful, because especially parents, because parents go with their kids to all these different environments. So they're able to practice all these different things, and they're able to talk to all these different people. Parents are the ones that talk to everybody, the teachers, the therapists, the counselors, the neighbors. And so parents really do need to be equipped to be able to not only teach their children the skills that the children are learning in ABA therapy, but also teach other people how to teach these skills. Parents are really the key to success in terms of helping with generalization and with and really helping with intensive intervention. So I always tell families, I don't personally think that you necessarily need a 20 plus hour a week program if you're willing to do a lot of the work. And I actually think it's always better for a parent to do most of the work versus a therapist doing the work, because you don't want your children to just learn how to respond to the therapist. I see that a lot. We always talk about instructional control. And I've seen a lot of situations where my clients, they know how to do so many things when they're working with the therapist, and their behavior is stellar. They make all these requests, they're hitting all their targets, they're doing everything exactly the way they're supposed to. But then when the parent tries to ask their child the same questions and have the same expectations, it's like they're starting at zero. And so that's why I feel like when it comes to intensive interventions, really the parents are the best suited to implement that level of intensity in the ABA therapy programs. So they should really be watching feedback on how I did. Like the parents really, the way I see it is they don't have therapists themselves in a way. So that's something that I do want to point out in terms of intensive intervention. So in ABA we get technical with our discrete trials. And so we always, as analysts, want to break down why somebody is learning something. So we look at the size of the array. So what that means is, let's say I'm working on matching, and I have, you know, a bunch of cards laid out, and I want my client to match them. That might be too large of an array of cards. And so I might take a bunch of cards out of the pile, and I might just put 3 in front of my client and ask them to match. My client might say, oh, okay, I understand what you're expecting of me. I can match them now. It's easier to see. So when we're teaching, we're always assessing, is the array too large, or is it too small? Is it too messy? Is it too neat? Why isn't my child I also put on their display of array learning. And so, if you ask them, to identify for example, you might say, point to the picture that has a circle on it. An array that's like and if you have an array messy, like there's cards kind of all over the place, they might not, but might then have a better time scanning. So those are some things that we look at. So when we have a child that's having a hard time learning, we all try to break things down and make it easier and make things eventually, because we want our children to be able to, because that's how most environments are. A lot of children with autism have the tendency to, and that's just not the way real life is. If you look at just an average kid playing with their toys, they're going to leave a mess everywhere, and they're going to transition from toy to toy very quickly, and it's going to be messy and loud. A lot of times you see a kid with autism playing, and their play area might be a lot neater because they've focused on one toy and they've lined things up and they've made it very, very structured. And so although you do kind of structure things a lot in the early stages of teaching a person with autism, to make it easier and to minimize a lot of times behaviors just resulting from how difficult tasks are, eventually you do want things to be harder and more real life. So arrays are something that we look at. A lot of times you'll see an ABA therapy program where they're teaching a child, the behavior analyst might be teaching the child to identify pictures or objects. They might say, okay, give me the spoon, or give me the cup, or whatever it is, and they've got this neat array of flashcards, and the child might say, okay, well, this is a cup, I know that this is a cup. But what if you go to the kitchen with that same child and you go in front of the cupboard and you say, can you give me a cup? Will they then visually scan the cabinet, like, okay, these are not cups, these are plates, these are napkins, and find, okay, this is a cup? Will they, like, that's more complex. So that should always be the end goal, is what is it supposed to look like in real life? Why are we teaching in the first place? So arrays are something that we pay attention to. Another thing we pay attention to is types of target.
I apologize for the technical difficulty here. Just bear with us for one moment. We lost Anna.
Office chairs, or they might, you know, but a 5-year-old will definitely know what a spoon is, because they have to use a spoon to eat. They might know what a bowl is, you know, because they have to use a bowl. They're going to be able to identify toys that they generally play with. You know, even chairs. You know, there are some cultures where people sit on the floor. They don't sit in chairs. So then, if you're having your child, you might have your child identify a mat instead of a chair. So when you're picking out targets, you want to pick targets that your client is actually familiar with, that they will actually recognize. Because then they're going to remember what you're teaching them. If you're using a target that they don't really see on a daily basis, like an orangutan or a giraffe, they might not have as many practice opportunities to practice the skills that you're teaching with that target. So you always want to look around you. What does this person have around them? You use now, you know, going back to this concept of generalization, which is something I'm going to talk about a lot. I think it's pretty unique to working with people with autism. It's making those connections, like a picture of a cup is not the same as a cup. Picture of a car is not the same as a car. And I have actually had clients that I've asked them in their brain being to the, you know, or what was this, and I might in there to the graph and the same thing as a true. So that's why when you're picking your targets, I think it's good to use a combination of flashcards and real life targets. I tend to stray away from flashcards for that reason, because of that tendency to not generalize and to respond in a row. It's better to be able to respond to things that are around you. You know, that's real life. So I tend to use a lot of real life objects when I'm teaching. There's the VB map actually has a goal for matching pictures to objects. And I think that that's a really important skill. Like you need to be able to understand that the picture and the object are the same thing. Multiple exemplars is another thing we talk a lot about, and that's basically giving many examples of a target. I've seen a lot of programs where kids with autism are taught to recognize different emotions. Sometimes facial expressions can be complex. And a lot of my clients with autism, they do struggle with recognizing, okay, this, you know, the nonverbal stuff, like this person looks like they're sad or they look like they're happy. How do you recognize that? And so the more examples of something that you show someone, the more likely they are to then generalize and in real life and recognize whatever it is you're trying to teach them. Because I don't know how to explain to someone how to identify. You don't always you know, your I mean, everybody has a some people tears, some people don't have tears. And so how would a person with autism, when you're trying to teach them these concepts, how would they know? Well, you just have to give them lots and lots and lots of practice opportunities. So that's basically what we explore. Do you mind scrolling down a little, Emily? There we go. Okay, so okay, so man, we're going to be talking about generalization a lot. So another thing that I pay attention to when I'm teaching my kids with autism is the environment. You really want to teach them to respond in the actual environment where they're going to need the skills, or an environment that's very similar. So for example, if I've been working with a child at a table, skills that they should be using in circle time, are they going to use those same skills in circle time? Like ideally, if you're working on social skills, you should work on social skills in playgrounds and, you know, areas where kids interact. If you're working on academics, I think academics are perfectly fine to work on at a table, because that's generally how you're going to work on them in the real life. But circle time goals like responding to group instructions, or responding to instructions, or even imitation, there's imitation goals. Those generally kids are going to use them in circle time. Like when they see all the other kids marching, they should march. Or whenever the teacher tells the kids at circle time, okay, everybody sit down, everybody should sit down. Everybody should be paying attention to the instruction. So you do want to teach in environments that look very, very similar to the real life environments, in order to help people generalize the things that you're trying to teach them. So we pay attention to how we give instructions and what kinds of instructions that we give. So going back to this idea of generalism, I've seen a lot of kids become rote and only respond to very specific instructions given a very specific way by specific people. And then when you vary that, it's almost like the instruction changed entirely. So, so you want to pay attention to your tone of voice. You know, when you're looking at how most people respond to instructions, most people respond to different tone of voices. I was familiar with, they might use a stronger tone of voice, or a more assertive tone of voice. They might not say like, hey, you know, I'd like for you to sit on your bottom. They might say, sit down. You know, it's different the way. So the way that people talk in different environments is very different, and you want your clients to really be able to listen to what people are saying, no matter how they say it. So I always pay attention to how do teachers talk? How do other kids talk? My clients, how do they try to be similar in I've seen a lot of therapy videos where you've got like the kid and the therapist is saying, give me the apple, point to the blue one, and they'll say, like, oh, blue, understand that it's the exact same question, but in a totally different tone of voice. And so I think it's important to keep that in mind. Also, who's giving instructions. I've noticed a lot of my clients with autism, adults, and I think it's because adults are predictable. They give instructions the same way and they reinforce, and they're all kind of similar. Kids aren't as predictable. Kids say things in a funny way, or they don't wait around for you to respond, or might not be, they might not interact with you the same way. And so a lot of times, tell them to do something so that they can start responding to more and more different kinds of people in different kinds of environments, and just really the likelihood that they're going to respond to things in a rote manner. So always pay attention to be able to say, point to the cup. Which one's the cup? Can you hand me a cup? Is there a cup around here? Instructions, SDs in the ABA world, and that's really sometimes I've noticed that kids, a lot of kids with autism, they've learned things maybe by one person who gives instructions a certain kind of way. And so then when you change the instruction, they no longer know how to respond. And so sometimes it helps to break down instructions and make them concise if your client is having difficulty responding. But then sometimes it's also good to vary those instructions, because you do want to challenge. I think that we really do want to challenge, because like I said, it is a very chaotic, messy world out there. We've got to prepare our kids with autism for that messy, chaotic world. And so a lot of times we do vary the words that we use in the instructions. We might, proximity refers to how close you're standing to someone. Sometimes I might give an instruction from far away, because I've noticed a lot of my clients, they won't respond to my instructions because they're so used to being told from this far away to do something. So I pay attention to proximity, individual versus group. What kinds of things do you tell a group to do versus an individual? A lot of kids with autism have a hard time responding to group instructions. So if the teacher goes up to you individually and says, Joseph, sit down, that's not the same as saying, okay, class, everybody sit down. And so you really want to get your child used to responding to all kinds of instructions and all kinds of environments in many different ways, with many different words and many different people. Prompting, that's another thing that we use a lot in the world of ABA, and I'm going to give some general guidance on kind of what types of prompts to use. We've talked about time delay. Time delay prompts is basically where there's an expectation or instruction, and then you just kind of wait to see if your client responds. Give them a chance to try to figure it out. A lot of my clients are what we call prompt dependent. It's almost like they wait for a prompt. It's almost like they have to have the GPS. That's what I compare it to. And they're not given too many opportunities to just make a mistake or try their best or try to figure it out on their own. And so that's where time delay prompts are really helpful. So when you're teaching requests, waiting, and seeing, well, how is this going to play out? Don't jump into rescue too quickly all the time. Visuals are so helpful. A lot of kids with autism, or people with autism in general, they benefit from visual schedules, social stories, checklists. Like when I'm working with adults on daily living skills, like how to wash your clothes or how to cook a meal, always my teachers wonderful prompts. Sometimes a lot of people use scripts, like when you're teaching social skills, you might hand someone a script so they know, oh, I'm supposed to say, hi, how are you? I think that the so physical to do some of those I usually use for discussion and have them brush their hair. Or if I'm teaching them to adaptive skills, I always tell people to stand behind the individual when you're using physical prompts, because when you're standing behind an individual, there's a few benefits to that. One is you can move backwards and fade out that way more easily. The other benefit is that you're no longer a visual prompt. So this person isn't relying on seeing you, they're relying on you moving their body for them. And so, you do want to, and so I think that when you're teaching adaptive skills, it's really good to use physical prompts, but to try to prompt from behind the individual. And I always tell people to, whenever you're using physical prompts, try not to speak. Like, it's a lot of times I'll see people say, okay, it's time to brush our teeth. We go up and down, back and forth, back and forth. Okay, now let's put on our shirt. You put it over your head and then you put your arms. And the problem with that is that there are a lot of kids out there that that will depend on you telling them what the next step is. And so if you really want your loved one to perform a task without you helping them, you should really prompt without saying anything at all if you can help it. So that's, I really do try to encourage caregivers to always stand behind their kids, use physical prompts, fade them out gradually, and don't speak throughout the process. Gestural is another type of prompt, and that's like pointing to stuff. Priming is really, really helpful for preventing behavioral issues and also for increasing independence, so for reducing that prompt dependency. So what priming means is that you're giving the prompt in advance, like you're setting up your expectations before there's even the expectation to engage in a behavior. So to give you an example, like if you're going to go to the grocery store and you already know that every time you go to the grocery store, when you walk down the candy aisle, there's always a meltdown, then what you would do is you would prime in advance. Okay, we're going to go to the store and we're going to, do this, this, and this. And then we're going to go down the candy aisle, and I don't have any money for candy. But if you wait till we get home, I'll give you a candy at home. That's an example of priming. And priming is really helpful too, to help people know kind of what to expect, because I think a lot of people with autism, they get anxious or frustrated because they really don't know what's coming, like what's next. And so preparing people for transitions can be very difficult, for changes can be very helpful. So being able to say, like, there's a difference between saying, you need to wait, or, okay, wait for 5 minutes and then we'll do, whatever it is you need to do. Or, I'm busy on the phone, why don't you go, I'm going to be busy on the phone, why don't you go and play with this toy, and then I'm going to take a phone call. So before you even take the phone call, you're already telling that person, this is going to happen, and this is what I would like you to do. Another example of priming is, if you're putting limits on technology use, for example, instead of just saying, okay, well, you know what, you've been on there 30 minutes, it's time to give up your iPad, you might tell the individual, hey, in 5 minutes, it's going to be time to give up the iPad. And in 4 minutes, it's going to be time to give up the iPad. Okay, you've got 2 more minutes left, etc. That is often very helpful to a lot of people. You do reduce a lot of behavioral issues by setting up expectations in advance. So that's something I do a lot of, is priming. And that way you're not prompting people through every situation. They already know. I used to do this a lot when I was teaching in the high school. I would tell my students, okay, this is how you order like we would go out to restaurants and I would tell them, okay, you're going to order your meal. This is what you're going to say. Does everyone know what to say? Do you need to practice? And we would practice, okay, then whenever the waiter came by, you've already prompted them in advance, so then they don't need your help in that very moment. They might remember what you guys talked about, previously. That's how priming helps reduce prompt dependency and increase independence. What else? Okay, so now we've got generalization. Generalization training is next. I talk about generalization a lot, and I really think it's just so important. It's such a struggle. Generalization is really a struggle for a lot of my clients with autism. So a lot of times you'll hear people talk about mixing and varying. So that's mixing the types of instructions or the types of tasks that you give. I've seen a lot of my clients with autism become very rote, so they kind of memorize the order of their therapy programs, so they and then they even remember the order of the data sheets. They already know they're going to yellow to airplane to car. I mean, people with autism have really good memories. I mean, it's really impressive a lot of times how good a lot of my clients' memories are. And so a lot of times I will mix and vary what I teach. So I might say, okay, I'm going to ask you to point to a blue car, and then I'm going to say, what is this thing over here, and what's your name, and just throw things at them kind of randomly. And then you have to pay attention to the words. You have to pay attention to what the people around you are telling you, because now you can't just memorize the order. I know we already talked about prompting and prompt dependency, but I do want to point out, pay attention to your body language, because a lot of kiddos with autism that I've worked with, people use a lot of gestural prompts without knowing it. Like they might say, hand me a Kleenex, and they're doing this. But what if you put your hands behind your back and you say, hand me a Kleenex? Will your client know what to do? So a lot of times I'll tell parents, when you're talking, just put your hands behind your back. Like, don't use your hands at all, and try not to look at things. Like a lot of people say, hand me that Kleenex. So I always tell people, don't look at anything and don't move your hands, and see if your child still actually knows what you're asking them to do. And a lot of times you'll see where my clients have difficulty in the absence of really just listening to the things that people are saying. They're relying on context clues. And so people prompt without even realizing they're prompting. So I always tell people to be very conscious of that. And we've already talked about different environments, teachers. We've talked extensively about generalization, so we can move, if you want to scroll down. It's frozen. I'm not sure. Okay, there we go. Okay, best practices in teaching social and communication skills. Social stories are really popular for teaching, I mean, any kind of social skill. I've seen so many different social stories, from how to transition from class to class in middle school, to how to greet your friends, to how to talk to your teacher. I mean, there's just so many different topics out there. The thing with social skills that I know a lot of social skills, a lot of people read social skills from this one book by Carol Gray. Carol Gray has a ton of social skills, and there's a lot out there, but you can make your own social skills to teach any kind of social skill. One thing that's really important when you're using social stories is to teach exactly what behavior it is that you want your client to engage in, or teach exactly the skill. Make it like pretty concise and pretty straightforward. So instead of saying, for example, well, you need to be polite when a teacher walks in the room, that's vague. A social story might say, when a teacher walks in a room, Bobby says, "Hello, Miss So-and-so." That's more specific. So you always want to teach the specific behavior. With the social stories, it's always, you're basically writing a story, like a character is engaging in a social skill, and your client is reading the story about this character, but really it's you're modeling for your client. And always focus on what your client should be expected to do and not what they shouldn't be doing. So your social story shouldn't be like, oh, Bobby doesn't throw tantrums, and doesn't hit his friends, and he doesn't throw furniture at people. That's not helpful. Like you really need to explain to the client when Bobby gets mad, Bobby goes and cools off in his room.
Anna, we've lost sound, sadly. Okay.
Oh, we've lost sound.
Back on. And we'll end at the end of this segment.
Okay. So, so video modeling, it helps when the model of the video modeling is similar to your client. So if it's a man that's learning the skill, the video should be of a man. If it's a little girl, the video should be of a little girl. It makes more sense when someone that's similar to you is performing the skill that you're trying to learn. And we've already talked about peers as coaches. Peers, it's really helpful to be around other people that don't have autism, because they end up being really good models of social skills. Pairing and pairing we talked about previously. Whenever you're pairing, like when you're playing and you're saying, oh look, it's an airplane. it goes in the sky, you're essentially teaching communication skills to your child because you're using a lot of words in a fun environment. You're sitting down and teaching them in a rote manner. So just to kind of summarize some best practices for communication and social skills. So, okay. And if you want, we can stop there because I know we've got a lot to cover and we're going over time.
Yes, ma'am. And also, for some reason, we're having some technical difficulties as well where the sound cuts out. So I think we'll have to stop here and then start again. On our next topic, we will be talking about transition planning. And so I really look forward to that because, Anna, you were so thorough and you provide a great insight on how do people work with people who are autistic. And I think that your attention to detail and your relatable examples will definitely help staff and caregivers to work with people with autism effectively. So thank you so much for that.
You're welcome. Thanks for inviting me, Emily.
You're
Hopefully
very
you guys benefit from this.
Yes, I'm sure. I'm absolutely sure that they will. If you have any further questions, feel free to reach out to me. Again, my name is Emily Roman, and you can reach me at tst@acog.com. That stands for Transition Support Team, tst@aacog.com. And I hope that you enjoyed this presentation, and we'll see you next time. You guys keep up the good work out there, and thank you for what you do.